Hi, my name is Jeffrey Sargent, and this is,
Audrey Hoffman.
and we are part of the Occupational Therapy Doctorate Program, class of 2020. And this is our
Community Agency Organization.
Enjoy. This organization is one of the first, if not the only organization to start a camp for children experiencing loss of limb deficits or impairments. They have 10 locations nationwide, and they are the first of a kind to be able to provide on-the-spot occupational therapy intervention, as well as physical therapy intervention. This nonprofit provides rehabilitation services to children experiencing loss of limb impairments. They are supported by occupational therapists, physical therapists, prostheticists, and adult amputee role models. The occupational therapy that is provided on site provide techniques and training with activities of daily living, or ADLs, which include dressing, bathing, meal preparation, and writing. These also are activities or instrumental activities of daily living. The physical therapists that are on site will help teach and refine the children's skills and activities like running, biking, outdoor activities, and navigating stairs, and other common obstacles one may experience.
According to Kilhoffner, the field of occupational therapy exists because its practitioners provide services that make a difference in the lives of their clients. This has always been and always will remain the central purpose and value of this profession. Based on this concept, we came up with our own definition of what occupational therapy is and what it means to us. And it is the process of helping someone become independent again. If an individual is struggling with any physical or mental impairment which makes daily living tasks difficult, occupational therapists can help them perform those tasks easily and independently. OTs set up goals with clients and work to accomplish those goals. This could be a range from being able to get dressed by oneself to engaging in physical activity easily, or helping an individual pay their bills, and everything in between. So engaging campers in occupational therapy services can greatly enhance their quality of life.
This camp provides services to children of all genders experiencing limb loss from the age of 3 years old through the age of 16 years old. This camp also provides services for families during group sessions and educational sessions to further enhance and support the client's life and lifestyle. This camp has provided services for over 1,250 clients in 2016 and has served 250 families in 2016 as well. The clients of this camp are children that range from the age of 3 years old to the age of 16 years old. And each of the clients that are approved and sent to this camp are of all genders and are experiencing limb loss. This camp provides services for families during group sessions and educational sessions to further enhance and support the client's life. This is a very big part of occupational therapy, and is a big part in almost just about any setting, is getting the family involved in the therapy and the interventions provided to children to make sure that then when the children go home, that the families too can care for the child and provide the best quality of life for that child to be able to recuperate and rehabilitate. This campus provided services for 1,250 clients in 2016 and has served 250 families.
So, when the campers receive OT services from this organization, there are a number of different theories or models that the OTs can choose from when it comes to intervention. One of those models that the OTs use is the proprioceptive neuromuscular facilitation model, otherwise known as the PNF. The goal of this evaluation is to gather a comprehensive picture of the strengths and challenges of the client's capacity for movement. The PNF incorporates methods which are used to improve movement patterns and developmental postures through exercises such as stretching and muscle facilitation. According to the PNF, motor behavior develops in a sequence of patterns. However, there is overlap between the stages. The development of motor behavior requires step-by-step learning, repetition, and stimulation. In order for a client to improve, their muscle groups must frequently be worked through the use of techniques which facilitate muscle action, innervation, and reflexes.
One could infer that the occupational therapy assessment used at this camp would be the assessment of motor and process skills, or otherwise known as the AMPS assessment. This is a standardized, contextual, and culturally sensitive evaluation of instrumental activities of daily living performance, as well as the individual's underlying competency in motor and process skills. One of the most important parts of the AMPS assessment is that in this situation, the child will be able to choose the instrumental activities of daily living that they want to perform as part of the assessment. Using AMPS, the OT can assess the client on the spot through observation of the child's performance on the instrumental activities of daily living, while also being able to assess functional mobility, motor skills, and voluntary action. Essentially, one of the foundational parts or foundational concepts of occupational therapy is that functional ability can be assessed through the performance of occupation. So using the AMPS assessment, this really brings out the foundations of occupational therapy.
Utilizing the PNF approach, which was mentioned earlier, a therapist at the camp would begin a session with stretching and other various preparatory exercises, such as Pilates, followed by facilitating proper goal-directed movements for strengthening muscles. For example, the campers could begin through stretching upper extremities, then finish by using facilitation techniques provided by the OT to either develop or refine motor skills and voluntary motion. These exercises would help the campers gain better control of their limbs, which allows them to independently engage in activities. Examples of some of these techniques would include sensory stimulation, which involves stretching muscles and providing resistance, ear irradiation, which utilizes stronger muscle groups to strengthen weaker muscle groups, successive induction, this facilitates voluntary muscle action, and reciprocal innervation, which incorporates voluntary motion to stimulate reflexes. The OT may also engage a camper in performing activities of daily living. This would include bathing, dressing, meal preparation, and writing.
While there is no outcome of occupational therapy services at this location or nationwide at this time for these services, coupled with the assessment provided by the AMPS assessment, as well as putting in place an exit interview or exit assessment when the clients or campers leave the camp, would provide a good outcome measure for the successes experienced by the clients and the successes implemented by the therapists on site at each of these camps. The occupational therapy services implemented on these campsites will help to impact the overall abilities of the children concerning activities of daily living and instrumental activities of daily living. So again, while there are no outcome measures that are in place at this location, there are definitely several different outcome measures that could be put in place that not only would help this camp be able to measure the successes of their clients, but would also contribute to the overall evidence-based practice of occupational therapy services nationwide.